My name is Harvey. I'm the Chief of Thoracic Surgery at the NYU Langone Medical Center, and I want to say a few words about oncanase. Oncanase is an unusual sort of drug used to treat malignancies. It's an RNA ACE. It is a novel class of drugs that actually interfere with the actual molecules that actually determine what proteins are going to be made. I've done many trials with oncanase, specifically in mesothelioma. What I've seen with mesothelioma is that indeed it has treatment responses, it has low toxicity, and that patients will benefit from the drug alone or in combination with adriamycin. There has been a large trial in which oncanase was combined with adriamycin and compared to adriamycin alone. And indeed, what was found from that trial is that patients who have been treated with mesothelioma already with chemotherapies actually derive benefit from having the combination of adriamycin and oncanase. Now, what does that mean for the mesothelioma patient? Mesothelioma is a very cruel disease. It is incredibly difficult to treat with chemotherapies. There are very few options for patients who have failed primary chemotherapy when they have mesothelioma. So we need to have drugs that after the primary treatment of the disease, we're going to be able to salvage these patients. And the only way to do that is if we increase the response rates for these patients after they've been pre-treated. Now, the importance of this. Turns out that there are many mechanisms that keep one from getting a response after you've already had chemotherapy. Some of these involved pathways that are molecular pathways that actually work against having a response when you give a certain type of treatment. Those pathways include things like NF-kappa beta. Those include genes that are called multi-drug resistance genes, which are certain types of what's called transporters. That's really neither here nor there. But what's important is that why is it that in mesothelioma, in that big trial, adding oncanase to the adriamycin was able to help those patients? Well, we did some actual experiments in our laboratory in which we looked at what oncanase did to mesothelioma cells and found that oncanase actually controls machinery that drives how the cells work. This machinery is called microRNAs. MicroRNAs are master controllers, and it turns out that oncanase controls two specific microRNAs. And what's even more important is that those microRNAs had profound effects on those genes that have to do with chemoresistance. In other words, you're able to lower the levels of those genes that keep chemotherapy from working, which makes sense. So then the mechanism of action that oncanase actually interferes with pathways that keep you from getting a response would be a good thing for patients who need to be treated, who have already been treated with chemotherapy. We're actually taking these findings to another level. Lung cancer is also a devastating disease for 170,000 people in the United States. And once somebody gets a response with chemotherapy drugs, the chance of salvaging that patient or getting a good response decreases for the same mechanisms that we discussed with mesothelioma. Therefore, at the NYU Langone Medical Center, Abraham Chichua and myself, in combination with the Alpha Cell Company, are doing an innovative trial in which we are treating patients with the best standard chemotherapy for lung cancer, and then seeing those patients be treated to a maximal response. And then we will treat those patients with oncanase and see if we actually improve the response even further after they've already had the standard therapy. That trial is a very important trial because it will give us insight into whether the mechanism that we found in the laboratory actually is going to translate to clinical benefit to patients by adding oncanase to chemotherapies after patients have been treated already with chemotherapy. I think that this is a very important trial. I think it's a very important trial with a novel agent, and that's what malignancy needs, trials in novel agents to try to overcome chemotherapy resistance. Thank you.